This video we are seeing the nephrotic versus the nephritic syndrome. So to start with a few questions. So the first question being, in case of the nephrotic syndrome, what is the principal site of the glomerular injury? Next, name important clinical features of the nephritic syndrome. Next, in case of the nephrotic syndrome, what are the associated the glomerular pathology? So by the end of this video, all these answers will be given. So looking at the nephrotic syndrome. So the nephrotic syndrome, firstly we look at the primary pathology. So we will firstly fully deal with the nephrotic syndrome, and later on we'll jump to the nephritic syndrome. So in case of nephrotic syndrome, the primary pathology, includes a damage as well as a dysfunction. Damage and dysfunction of what? Of the glomerular filtration barrier, GFB. And what does this cause? This causes a significant leakage. And the leakage of the plasma proteins. And this is without much of the glomerular inflammation. Next, we look at the principal site. So the principal site of the glomerular injury. So the principal site, it includes the visceral epithelial cell. That is the podocyte. Then we look at what are the clinical features of the nephrotic syndrome. Okay. So the hallmark clinical features, it includes, there is heavy proteinuria. So this is about 3.5 gram per 24 hour, or urine protein creatinine. So the ratio here, it is greater than 3. Next, we also have the hypoalbuminemia. Next, the other features, it also includes the presence of edema. There is presence of lipiduria as well as the hyperlipidemia. Next, there is also the microscopic hematuria. There is presence of the hypertension as well as the hypercoagulability. Then we look at what are the clinical features in case of the pathology, the glomerular pathology. So here there is presence of the minimal change disease. So that is primary and secondary. There is also the focal segmental glomerulosclerosis, that is the FSGS, that is also the primary and the secondary. Next, what are the associated glomerular pathology? It includes the membranous nephropathy, that is again the primary and secondary, and the diabetic nephropathy, as well as the amyloidosis. Now we jump on to the contrary, that is the nephritic syndrome. So in case of the nephritic syndrome, this is the glomerulonephritis. So here the primary pathology being there is significant inflammatory injury, and this is of the glomerulus. This significant injury to the glomerulus and resulting. So what does it result? It results in the passage of the RBC and the inflammatory cells as well as the plasma proteins. Next, what we see is the principal site of the glomerular injury. So looking at the principal site of glomerular injury, it includes the endothelial cells. Next, it also includes the glomerular basement membrane, that is the GBM, presence of the mesangial cells, and the parietal epithelial cells, okay, PEC. Next, we move on to the clinical features, which was earlier asked. So in case of the clinical features, it includes the hematuria. Very, very important, hematuria. That is presence of the RBC cast as well as the dysmorphic RBC. Next, there is also the varying degree of the proteinuria and the pyuria. Next, there is also the renal dysfunction as well as the hypertension. Now we jump to the what is associated glomerular pathology. So in case of the associated glomerular pathology, it includes the acute post streptococcal glomerulonephritis. Next, it also includes the rapidly progressive glomerulonephritis, that is crescentric. Next, it includes the IgA nephropathy and also the membranoproliferative glomerulonephritis and the Alport syndrome. Now, to answer the questions which was earlier asked, so what was the principle? We saw the nephrotic syndrome, that was the question, first question, nephrotic syndrome, and the question was what is the principal site of the glomerular injury. So the principal site is nothing but there is a visceral epithelial cells, okay, and there is nothing but the podocyte. Next question which is asked here, nephritic syndrome, that is a glomerulonephritis. So here what are the clinical features, the hallmark clinical features? So that included the hematuria, and that is nothing but the presence of RBC cast, the dysmorphic RBC, as well as the varying degree of the proteinuria and the pyuria. Next, in case of the nephritic syndrome, there is also the renal dysfunction as well as the hypertension. Next question was third question which is asked in this video. So we saw what is the nephrotic syndrome and its associated glomerular pathology. So here we saw there is presence of the minimal change disease. So this included the primary and the secondary. Next, we saw the focal segmented glomerulosclerosis, FSGS, and this is also primary and the secondary. And the third is the membranous nephropathy, that is again the primary and the secondary. Then the diabetic nephropathy as well as the amyloidosis. Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.